Welcome to another edition of Medically Speaking. As you can see, we are practicing safe social distancing. I'm Mike Hughes, and today I'm joined by three respiratory therapists who are on the front line of COVID-19. David Lai, Terri Ya, and Nadine Logoljarka. Welcome, guys. Thanks for joining us today.
Thank you, Mike.
Yeah.
If we can, let's please start. I want the viewers to learn a little bit more about you guys, where you work and how long you've been a respiratory therapist. So Nadine, let's start with you. How long have you been a respiratory therapist? Where you work?
I work at Buffalo General Medical Center, and I've been a respiratory therapist for over 30 years.
Terri, how about you?
I work at Millard Suburban, and I've been there for over 42 years.
Okay. David, how about you?
Buffalo General, and I'll be a respiratory therapist for 20 years next month.
Okay. Well, Terri, you win the prize with having the most experience. Tell us a little bit about what a normal day for a respiratory therapist prior to COVID-19. What's a normal day look like for you?
A normal day was not terribly hectic for the most part. We would spend most of our time doing medication administration. We had ventilators in the ICU, but probably averaged maybe 4 to 6 a day. We weren't super busy with that, and we would be part of the rapid response team. So some days we would get no calls, and some days we could get, half a dozen a shift, depending how things go. But it has certainly changed.
So Nadine, talk a little bit about prior to COVID-19 and what your daily routine was like.
We were in all aspects of the hospital. We were all over on all the floors, present from the patients. We would see them from admission to discharge. We would go on rapid responses. We would do patient teaching on the floors. We were in the angio suites assisting with nitric oxide, ventilator weaning in our ICUs, and we would average 30 to 40 ventilators a day all over in the GVI and here.
David, let me ask you, how has your job changed? And really, what did your daily routine look like prior to this?
Well, it's changed just the acuity of the patients. They're a lot sicker than really any patient we've seen, just in the volume of them. The ventilatory support, ventilator settings are higher than we've ever seen and longer. These patients are on long. Normally, our plan is to get these patients off right away. We need patience with them because it takes so much longer to get them healed, get them off. It's tough. It's tough when you go in a room and you see how it affects them, and you wonder, we just don't know. We don't know how it will affect us, with coworkers, myself. So it's been tough, but we're getting through.
Terri, let me ask you, since the coronavirus hit, there's been an awful lot of talk about respiratory therapy, ventilators. Did you ever think that your field would be in the spotlight the way that it is in a situation like this?
Well, I didn't think that we would be, and I still really don't hear a lot of talk about the respiratory therapists. I hear a lot of talk about ventilators and intubation days, but there are really mystery people that seem to be doing the work behind the scenes. Have not heard a lot of mention of respiratory therapists. So when we do get a little recognition, it's nice to hear. And most people don't know who we are.
So Nadine, why don't you pick up on that? I mean, that's one of the reasons why we wanted to talk to those who are on the front line from what has been kind of the behind the scenes position of a respiratory therapist in some people's eyes, but really you guys are a critical function of the hospital process, of the clinical care model, not just in COVID-19. Tell us a little bit more about that.
We're the hidden gem that people don't really realize. We're always there when any type of emergency situation, from infancy, newborns, till geriatrics. There's always a respiratory therapist present during any type of emergency situation. This COVID-19 has brought us out into the spotlight where we can shine a little bit. This is what we train for our entire lives. The intensity of these patients is a lot different than we're used to seeing. But we work as a team. We work with the physicians, the NPs, the pulmonologists, the nurses. We all collaborate together. And we've seen stuff that is against the norm. We've had to go on different pathways. We've had to go with what we consider old school ventilation. So the senior therapists are leading the younger therapists, but we're always there. We're in the forefront. We don't ever get the spotlight. So this is different for us to be out here and be seen. And it's a good thing. It's a good thing for the profession. It's good for people to know that this is a profession that people can go into. We save lives.
Yeah, there's no question about that. Dave, I think you used the word, it's tough, as the way you were describing it, kind of the current situation. So tell me a little bit about how you manage your stress. First, how are you managing the stress while you're on the job? And then how do you manage stress, while you're at home in terms of worrying about work or juggling things at home? My guess is that your life has become much more stressful over the last 6 weeks.
Absolutely. Tough. It's tough physically. I mean, the PPE in itself, being in these rooms with masks, gloves, gowns, goggles. I mean, it's hot. It's hard to breathe. You're in these rooms for sometimes hours. Physically taxing. Just you need to be on the patients, everything they're doing. We're doing our best. We're just managing.
Terri, let me ask you a little bit about that. I mean, over the course of your career, I'm sure you've seen quite a bit, whether it was, H1N1, the Asian bird flu, SARS, mass casualty incidents, things like that. But this current public health crisis, what kind of stress level has it brought onto you? Someone who has the experience and probably has, maybe put in quotes, has seen it all.
It's a little taxing. We do have, our staff is kind of, half of us are older and have a lot of experience, half are younger. And we definitely are helping the younger ones to look at things differently. It's a lot of technical knowledge as far as using the equipment. It's just things that I have not really seen before. And we're kind of going back, like Nadine said, old school ventilation, trying to get younger people to understand that what happens with these patients is not what we see typically with ARDS, that we have to treat patients differently. And so we actually have learned a lot, and we're doing a lot of new different therapies. I'm sure BGH probably did some of these things, being a bigger hospital, a bigger patient population. But it's been a learning experience. After this many years, I thought I wouldn't be able to learn anything new, and I have.
Sure. Nadine, how about you? Your stress level and really making sure that you can get your job done and not be too flustered by the intensity of every shift that you're working. Tell us a little bit more about how you handle that.
It is very intense, but we have a very good group of therapists here, and we look out for each other, and we know when somebody's getting a little overwhelmed and take them out of the medical intensive care unit, put them somewhere else that doesn't have as many COVID patients at home. I have 3 elementary kids trying to juggle this and Google Classroom and Google Dance and Zoom this and Zoom that, and keep my kids home and keep them safe and occupied. It's very difficult.
Sure. So, David, let me ask you, and I'll ask the three the same question. And it's something that it's on the mind of people that watch these videos, and it's probably the same question you guys are getting by your family members. What is it like to work on the front line right now?
It's very intense. It's very intense, and it's difficult, but it's what we've been trained to do. I mean, our skills and expertise in ventilator management, it's valuable with these patients now, and we'll get through it. I know we will.
Terri, how about you? When your family, your friends, your loved ones ask you, they know what you're going through, they see your emotion. What do you tell them when they ask you, what's it like dealing with these patients and really being on the front line?
It's scary. And, I try to encourage people to be safe and that it is a real thing that's out there. I am now taking care of patients who are much younger than I am and are critically ill and taking a lot of time and patience. And you take one step forward, you take 2 steps back the next day, and then you fight again, and you get these patients to take 2 more steps forward and maybe only 1 step back the next day. So it's a battle, and we just keep going every day, working a lot of hours. The staff has put in a lot of time just trying to take care and make sure everybody gets the care and the attention that they should have. Try and get them better.
Nadine, you have younger ones, you're saying, at home. Let me ask you, what do you tell them when they ask about how was work or what's it like having to deal with in this public health crisis?
I try to limit the amount of exposure they have to what I actually have to deal with at work. They know what my job constitutes, basically, and they know that I take care of people to help them to breathe. But I try to keep the bad stuff away from them still. It is very difficult. They can see my frustration, and then I'm tired. It's very draining, both physically and emotionally by the end of your shift. But it's also very, very rewarding. This is what we were trained to do, and this is where our time to shine. And people seeing what we do, and then when we see these patients get better, it's very rewarding.
So last question for everybody. We'll end on a high note. We've talked about the stress and how difficult it can be getting through your days, getting through your shifts, the intensity. But Nadine, let me start with you. Are you heartened by the outpouring of support from the community? It seems like, in particular Western New York, but across the state, across the country, that people have rallied around the healthcare workers. Does that, when you say, this is what we're trained to do, and it's gratifying, but does it help to see the support that you guys have?
Yes, it does. It really, really does. To see people appreciate what you are doing, it really gives you a good feeling.
Terri, how about you? There's been an awful lot of attention at Suburban and people dropping off meals, and the first responders are doing a parade around the hospital. What do you think about the community support?
It's been phenomenal. It really has been. We have had donations of meals. We've had the parade of, I think there were probably at least 50 first responder vehicles, fire trucks, police, ambulances that came in and paraded it through the hospital and the parking lot. And that brought tears to my eyes to think that, people are recognizing the work that we're doing. We have a couple of different people who have been making surgical caps for us to wear, so we have head coverings when we're going in and out of these rooms, and making sure that we have enough to last every day. So, when we're working several days in a row, you don't have to go home, do laundry right away. Just the simple things that you don't think of. Golf pencils, which normally you would say, who needs that? Well, we need them in the rooms because you don't want to be taking things in and out of these COVID patients' rooms. We just have had more food than we know what to do with. That they could bring us a treadmill. We could use that in order to work off some of those calories. But yeah, it's been phenomenal. It's been great.
David, you get the final thank you opportunity here. Any message for the City of Good Neighbors for all the support and gratitude that they have for you guys?
Absolutely. They've been great. We appreciate the lunches. We appreciate the support. And I do want to mention one thing before we go. I'd like to take a moment to acknowledge my coworkers. I've been impressed and inspired by their bravery and courage. And it's been tough. And I thank them for their dedication to the community.
Terri, David Lai, Nadine Logal-Jarka, respiratory therapists working on the front line, saving lives, battling COVID-19 every day. Thank you for your time today.
Thank you, Mike.
Thanks so much. Stay safe.